All right. Hello and welcome. I'm Victor Logan, an insurance broker for Midwest Benefits. Thank you for tuning in. And I want to start by telling you a little bit about myself. All right. I've been a health insurance broker for over 15 years. And in that time, I've found that people need help when it comes to Medicare. Multiple times, I've had people come to my office with thousands of dollars of medical bills because they may not have fully understood what they were getting into when they got into Medicare. And frankly, I'm tired of seeing it. So I'm making a video in order to be able to help people out there. Now, the government's Medicare program is covering less and less each year, causing financial problems and perhaps even catastrophes as far as that goes. And I'm here to provide you some information to help you navigate the Medicare system in all its parts. Now, as a broker, I can help you look at available options and see what may work best for you. And I'll definitely be able to provide you some information that can help you out here. What you do with that information, entirely up to you. But what's most important is that you get the information. All right. Now, we're here today to talk about Medicare and a few things you need to know. Now, we're going to start with the initial enrollment period. And the enrollment period is made up of 3 months before you turn 65, the month of, and 3 months after. It's a 7-month window. All right. So if you don't sign up for Medicare during those months, you can still sign up. All right. But you will incur penalties and will pay those penalties for the rest of your life. It's definitely something you should try to avoid. Now, before I get into that further, right, there are always exceptions to rules. You may have a special enrollment period. You may still have your medical and prescription drugs with a current or former employer, in your retirement plan. Then you would not be subject to the penalty. So I don't want to scare anybody out there about penalties. All right. I just want you to know that if you don't have something set up as far as your medical or your prescription drugs go, there's a possibility of incurring a penalty, and these penalties stay with you for the rest of your life. And there's a lot of information and rules when it comes to signing up for Medicare. So these are things that you need to keep in mind. You need to think about these things. So if you have any questions, please feel free to leave them in the comment section below, and I'll answer them, as soon as I can. I answer all comments and questions. All right. So we just went over that open enrollment period, and now we're going to get into the different parts of Medicare. All right. Now, we'll start with the basics. Medicare Part A and B. Medicare Part A and B is original Medicare. All right. There's more, but A and B is the original Medicare. Part A is hospital insurance. It will cover hospital inpatient benefits after your out-of-pocket is met. Now, it will also cover skilled nursing facilities, care, blood, home health care, and hospice care. Part B covers your preventive services, your surgical services, supplies, speech and physical therapy, and ambulance services. It also covers doctor visits. As I was stating previously, that is original Medicare. For those who are thinking about just having original Medicare, you haven't put any thought into what you want to do as far as, an additional plan that will save you a lot of money. Original Medicare was not set up for that, okay? Because there is no ceiling for how much they can charge you under original Medicare. Part A, great, covers the hospital. Part B, also very good, but you will have 20% co-insurance with original Medicare. All right, so I want you to keep that in mind. That's why I'm mentioning that. Now, Part C is what they call Medicare Advantage plans. When you choose Medicare Part C, you are off of original Medicare. You're no longer in Medicare Part A and B. You're now on managed care, right? A lot of people make the mistake of saying, I have a supplement. Well, Medicare Part C is not a supplement. I want to be clear on this point. It is a Medicare Advantage plan. It is managed care, right? Underneath Medicare Part C. You are no longer on Medicare Part A and B. You are in Medicare Part C, not a supplement. All right. So it's otherwise known as Medicare Advantage. It is a private health plan that replaces Medicare Part A and B. That means you are in an HMO. You are in a PPO. An HMO is a health maintenance organization, a PPO, a preferred provider organization. All right. And then there is Medicare Part D, or Medicare Advantage drug plan. That is a private health plan that helps cover the cost of prescription drugs. And you can get Medicare Part D included in your Medicare Advantage plan, which would be a Medicare Advantage prescription drug plan, or through a standalone plan from a private insurance company. And there are reasons for that. And I'll get into those later on if you have any questions about it. Now, as I mentioned above, Medicare is covering less and less each year. And while your Medicare expenses keep going up at that. So because of this, there's something called a Medigap Plan, what they call a Medicare supplement plan. These are 10 standardized plans. I'm not going to go into a lot of detail on this, but Medigap policies are private plans. They are available from insurance companies or through insurance brokers like myself. But you will not find them on Medicare.gov. All right. When doing research on Medicare supplement plans, you're always going to end up kind of looking at it through the eyes of an insurance company or through an insurance broker. Now, depending on the state you're in, there is only a one-time 6-month window to sign up for guaranteed issue policies. Keep this in mind. Once you turn 65, you get 6 months to sign up for a Medigap policy or a Medicare supplement plan. During that time period, there is no medical underwriting. That's what they call your guaranteed issue window, right? After that, the Medigap plans are available to you, but they are no longer guaranteed. You're outside of that guaranteed issue window, and that means that there will be medical underwriting. Basically, they're going to look at your medicals to decide whether or not you can get in the plan. So this is a wonderful opportunity to get into a plan that can cover those expenses for you that original Medicare doesn't cover. You should not let that opportunity go to waste. We've covered the enrollment period, all right? But before you sign up for Medicare, you should sit down with a Medicare specialist and seriously think about what your future is going to look like before signing up for any plans. And basically what I mean by this is that you need to look at the trajectory of your health. What's your health? What do you think your health is going to look like 7 years in the future, 8 years in the future, 10 years in the future? I know that's difficult sometimes for people to do, but it's really, really important because you're going to have opportunities, but somewhat limited opportunities to make changes in those plans. And when you do make those changes, you'll be up against a different set of parameters. So these are things you should think about. All right. Think about your lifestyle, the trajectory of your health, right? Meaning your current health conditions and what your health conditions may be in the future. And also, last but not least, your finances, really important point. Picking the wrong plan can hurt your future. All right. We've covered the enrollment period in different parts of Medicare. Now I want to touch base on the penalties that you may incur if you don't follow those Medicare rules. As long as you worked 40 quarters or 10 years, you get Medicare Part A for free. All right. 10 quarters, 40 quarters or 10 years, Medicare is going to come to you. You're automatically enrolled. Right. But as we mentioned before, if you don't sign up for Medicare Part B during the 7-month enrollment period, you will be charged a penalty. Now, one thing that I want to say, all right, I don't want to scare anybody out there or anything like that. There are people out there who are still with their present employer. So they have comparable coverage as far as Medicare Part B and comparable coverage as far as Medicare Part D, drugs and the Part B portion of it. They don't have to worry about that. For those who do not, right, if you didn't sign up for Medicare in that 7-month window, you can have some issues, all right? And you will be charged penalty for enrolling late in Medicare Part B and in Medicare Part D. It's not just a one-time thing either, so I want you to keep that in mind. You will pay the penalty for as long as you have Medicare or for as long as you are alive, whichever comes first. Now, I can give you a breakdown for this. It may be different for everyone, all right? So I can't give you exact numbers right now, but if you put some comments, questions down there in the box below, I'll be more than happy to go over that for you, all right? Now, that's all I'm going to cover today. Once again, I want to thank you for tuning in. I hope you learned something new about Medicare or something helpful about Medicare. If you have any questions at any time, please feel free to reach out to me. You can send me a private message or call 531-210-6849 anytime, and I will gladly walk you through the mess they call Medicare. Now, feel free to follow us on our Facebook page, and you will find that in the link below. You will also find our well, not just the Facebook page, but our website in the link below. Forgive me, I had a brain cramp there briefly. And please hit the like button and follow us here. All right. So thank you. And it was a pleasure talking to you guys. And I'll be back next month with more information on Medicare. And until then, take care. And I hope to see you guys soon. All right. Thank you.